Hi everyone, this is Cassie and this is my presentation on lymphedema. First, let's talk about the lymphatic system. The lymphatic system is specialized vessels in the body that collect excess lymph fluids from tissues. The fluid is then carried to the lymph nodes, which filter out waste, and also contains infection-fighting cells called lymphocytes. So, what is lymphedema? Lymphedema is swelling in one or more extremity, usually in the arms and legs. This is caused by damage or removal of lymph nodes, particularly from cancer. Swelling because of blocked lymphatic system. Blocked lymph vessels are unable to carry lymph fluid away, which results in swelling. More symptoms. Symptoms usually occur in the arms and legs, and it's typically in one arm or one leg. At times, it can swell into both arms or both legs, and there's also full or partial swelling, which may also include your fingers and toes. There is swelling of the hand, breast, or torso, which usually is from breast cancer. Some other symptoms you might feel are heavy or a tight feeling at the site of the swelling. You will also have restricted range of motion and aching or pain. Here are some diagrams of what the different stages of this swelling look like. There are two different types of lymphedema. There's primary lymphedema, which is anatomical abnormality of lymph vessels. This is a very rare type of lymphedema, and it's usually inherited and has genetic mutations, such as Milroy's disease, which starts in infancy, and the lymph nodes are abnormally formed. There's also Meiggs disease, which starts around puberty or during pregnancy until around the age of 35. Late onset lymphedema is rare and usually occurs after 35 years old. The next type is secondary lymphedema. Damage or obstruction of normally functioning lymph vessels. There's also lymph node infection due to cancer, radiation, surgery, or injury. The most common type of secondary lymphedema in the United States is from breast cancer, which is the cancer cells blocking the lymph cells. Also, radiation treatment for cancer can cause this kind of lymphedema, and the cancer itself because of the tumor blocking the lymph fluid. The most common worldwide type of lymphedema is from infection. The parasites restrict the lymph fluid. When being diagnosed for lymphedema, the doctors rule out symptoms involving the lymph nodes. Recent cancer surgery usually results in an immediate lymphedema diagnosis. There are no obvious causes, then there are MRI scans, CT scans, or ultrasounds. Also, lymphoscintigraphy is a radioactive dye that's injected throughout the lymph system. These are the different stages of lymphedema from 0 to 3. For treatments, there is no cure for lymphedema. We can only just keep treating this disease to help reduce swelling and discomfort. There are compression sleeves or stockings that are custom fit with the compression gradually decreasing from the ends of the extremity to the trunk. Also with bandaging, which is done in the same fashion from the ends of the extremity to the trunk. There's also a pneumatic compression device that are sleeves or stockings connected to a pump that sequentially compress from extremity to trunk. This cannot be used on people who have congestive heart failure, DVTs, or certain infections that are present. You can also do manual compression, which is a massage technique called lymph drainage. Light exercise also helps stimulate the arm and leg muscles, which stimulate lymph flow. Acupuncture is another source of treatment, and If this is done for lymphedema, they say to do this 2 to 3 times a week for 4 to 6 weeks. You can also try yoga and meditation along with diet changes, where you want to limit your sodium and calorie intake, stay hydrated, and eat plenty of protein. Cancer Treatment Centers of America also have a couple different kinds of surgeries that they can perform when lymphedema is at its worst. They have vascularized lymph node surgery and lymphaticovenular bypass surgery. To prevent lymphedema, you should avoid tanning beds and saunas, hot baths and showers, tight clothing and jewelry, and to be barefoot outdoors. Things you should do if you have lymphedema is to check skin daily for breakage, always moisturize, use insect repellent and sunblock, and raise the affected limb when possible. Although there is no cure for lymphedema, it can be managed with early diagnosis and constant care of affected areas. Thank you.